Hello and welcome to the another podcast of Blue Ocean on procurement and supply chain. Today we will deep dive more into healthcare procurement and supply chain. And I have a very special guest with me, Mr. Ajay Punjabi. I would like to welcome you, Mr. Ajay.
Thank you so much, Ahmed. It's been a pleasure to be with Blue Ocean today, and it's been an honor and privilege to be part of this fantastic session. Let's deep dive into how we can not only improve our knowledge and also gain the momentum of what's happening in the UAE healthcare sector.
Thank you. So let's begin with asking, what a procurement professional, in healthcare do as a specialist in general. What are the role?
That's a quite intriguing question, and I would say procurement as a profession overall. I would not put as a healthcare as one bucket, but the overall how the profession is seen is to buy any stuff. If any company, any corporate, or any hotel, for example, wants to buy something, they just go to procurement and they say, "Hey, I want this table, or I want this chair, I want this bed, I want a TV." But that's not how it works in healthcare. In healthcare, there is a full-fledged, multi-dimensional puzzle of what a clinician wants, what a nurse is going to work on, what a biomedical engineer, for example, if I'm buying an MRI machine, right? It's not about what brand they want, what are the features they want, which usually we see it in a let's say we buy a mobile, right? We see what is the gigabytes of the memory, what is the speed of the processor, how good is the camera, and these kind of fancy features. But in healthcare, it's about life and death. If one decision goes wrong, if we buy a product or a service which is not delivering over a life cycle of the product itself, because any such high income or a high revenue generating product or an item is not performing after 1 year, 2 years, 3 years, the whole of the process is a failure. So it's a multidimensional puzzle, as I said. So we need to see the financial aspect to it, the cash flow, the maintenance cost, the operating cost, energy efficiency. Now we are also driving towards sustainability. So is the equipment which we are buying, is it even sustainable at the end of its life? Are we going to dispose it? Is it recyclable? So now when we do a tender for any medical equipment, we also see that at the end of the life, let's say any average life of a medical equipment or a capex is around 10 to 12 years. Now after 10 to 12 years, when we are going to dispose it, so we do the declaration, we take the declaration from our suppliers, from our strategic partners, that how many parts of this whole, let's say I'm buying it for average 10 million dirham, right? How much is it can be recyclable, right? How much are we? It's not about the ROI. Obviously, the ROI is calculated within the 10, 12 years of the usage of the equipment, but ultimately, how much are we going to recycle it so that there's a less harm to the environment? So keeping aside all these things, now it can be as complex as a medical equipment to as small as a uniform, right? Now, staff uniforms for a healthcare sector industry is all about breathability, again sustainability, because every 8 hours, as per the protocol, they have to change the uniform. Or if they are in the highly infectious areas, maybe they have to change it every 6 hours. So the staff has to be comfortable, the uniform has to be easily dryable, right? So it has to be easily dried material, and again it should be skin friendly. So these are the factors which on the face of it looks very easy, right? Okay, I have to buy a uniform. You can buy it from anywhere. There are so many manufacturers out there in this country, especially in Ajman, but we have to take care of all the specifications. We have to go to the nitty-gritties of each of this. So yes, healthcare professional, coming back to your question, was very critical, that it takes a lot more understanding of what the impact we are making to the patient care. Even the food, I do catering tenders. We have done catering tender, and it's again the same question. The meal which is provided to the patient, tomorrow it can be me on the other side, right? Me taking the treatment and me getting admitted in the same hospital and having the same food. What kind of food will I like to have, right? The best quality, and what is being prescribed by the nutritionist or the dietitian, everything has to be taken care of. So the suppliers have to understand that this is not a the luxury industry. This is not a hotel or a restaurant that they can provide a fancy bouquet of platter. But yes, it has to be nutrition and taste as well, right? They have to control. There are so many liquid diet, for example. Many of the patients are on liquid diet. So what kind of liquid diet will they provide? Will they provide only a normal orange juice, or it has to be a fortified organic orange juice?
True.
Right? So it creates a whole lot of difference in the costing and quality and the service. So yeah, this is what would my take be.
In addition to this, your answer. So how do you decide, the medical equipments when you procure? So is it based on the cost, doctor's request, or is it like a patient outcome? Day-to-day challenge, very challenging question is and this is what has happened over past more than a decade now, that when I have been into the healthcare procurement, particularly in the healthcare procurement, where doctors, nurses, biomedical engineers, they prefer a brand, right? Now the preference is based on their prior experience, that yes, I'm using X brand, which is giving me the Y results, so I want to continue doing that. I don't want to change. And also, as a procurement professional, I have to see that yes, if I change their mindset, if I change their thought process, the responsibility is mine, because I'll not only invest in a new brand, there will be a training cost, because to operate an equipment, it's not True. Plug and play. It's not like a small phone which we buy or a laptop which we buy and we just start operating it. It takes a whole lot of training. So what are the maintenance costs? Is the equipment which I am suggesting as an alternate to the doctor's requirement or nurse's requirement, is it having a local support? Right? Because if something goes wrong, imagine an X-ray machine. Now patient is there and suddenly it doesn't switch on. Where do I go? Right? So these are the nitty-gritties we have to take care of. And I think most of the equipments come with the proprietary lock-ins as well. Yes, so, softwares are locked. Yes. Maintenance service contracts are locked. Just as you buy, a car, for example, and it gives you a 3-year, 5-year warranty, whatever. But that warranty is applicable only if you go to the authorized service center, not to any other garage. So similarly, medical equipment is even more sophisticated. You can't take a medical equipment anywhere, right? So the service engineer, whole service center or the service network has to be there in this country. That's also a factor. So whether it's cost or a preference of an end user, it's a very fine balance, because finance always will stick to the budget. The doctor will say, okay, I need a gold standard. But then we come to a common ground or a middle ground by analyzing what exactly needs to be done to ensure the patient gets what they need. Also, since it's hospitals, right? We are talking about patients, hospitals. It's also about the budget. And hospital is given a specific budget to run in an entire year. So if we spend more on one equipment, then there will be other departments or other equipment which will suffer. And if we degrade the quality, then there will be other repercussions on the patient safety, patient care, patient diagnosis, treatment, etc. So it is a fine balance that, okay, if the equipment can do 95% of the job, right, does not give me the, let's say, for example, X-ray machines. Okay, now X-ray is all about imaging, right? It's highly radioactive pictures have to be taken of the bones. This is what the job of in a layman terms, of job of a X-ray machine. As I was saying, imagine an X-ray machine, just to compromise slightly on the cost. If we buy a substandard quality of X-ray machine and the imaging doesn't happen right at the time when the patient is right there in the X-ray room, but what would a technician do? How embarrassing can that get for the hospital? It's also about the reputation of the hospital brand, right? So we need to be wary of all these factors and come to a level of understanding that doctors, who are our core stakeholders in this whole process, because they are the users, or the biomedical engineers, they are the users of the equipment which we buy for the patient care. They get what they want. At the same time, if we save that 5%, 10% from every equipment, they can budget it for a newer equipment as well.
in the same year, let's say. Not every year every equipment gets changed or upgraded.
But let's
But they
add to here, sorry, that the technological advancement, robotics, AI, everything is coming up. How do you manage that capex? Because it may get obsolete after maybe 2 years, or because you have to compete with your industry partners as well. So in that case, you are spending something maybe 10 million on an equipment, but you have another equipment in the market which is more efficient and more good for the healthcare, and your partner is having that kind of an equipment. So I think that is another risk which is added in the last few years.
I'm feeling I'm talking to my CEO, who always loves to challenge me that whenever we get any requirement from either of the hospitals, the network of hospitals which are operating in UAE, and this we have embedded in our requirement always as a part of our going proactive, not reactive. Now, what does it mean by going proactive? That we ask our strategic partners who are going to supply us or who are going to bid in that tender, we ask them that, okay, if there is any technology coming up in next 3 to 5 years, they will upgrade it for free, right? So that is already embedded in our contract. So that usually what happens is, it doesn't happen that the equipment's hardware will change, right? Only the software. Just imagine, to again correlate with in a layman's terms, I want to upgrade my RAM in my laptop, right? I have a 16 giga. I want to upgrade it to 32. I just need to add one more chip or replace 16 with 32, right? So that the performance improvises and I can go on for another 3 years. So same thing happens in the medical equipment or any capex industry, right? So if there is a ECG monitor or a ventilator, right? It's also, we all know, right? In COVID, the gold was ventilators, right?
True.
So why ventilators could not be supplied was because of the chip which was there, which is the heart of any IT product, any electronic product, let me put it that way, was not available in the market. And this is where the shortages happen, supply issues happen, and ultimately the patient suffered. So if this can be organized, it is always possibility to do that. And this is what we do it in our contracts as well these days.
Right.
And that's also again a learning to also add to this, since we are now talking on the learnings of COVID. This is also one of the learnings which has got embedded into our genes, right? We are from the healthcare procurement, so in our genes it is now embedded that we have to ensure two things. One, technology upgrades, which is also a part of sustainability, because if I buy something which has a life cycle of 10 to 12 years, maybe 15 sometimes, if we keep maintaining it in the right format, and also depending on the number of images. If I buy an extra machine but there are not many images being taken every day, yes, it can the life can be extended by a couple of years. There's no harm in it. But at the same time, sustainability and upgrades has to be covered up, so that we don't invest again and again and again. And then there are various ways and tools to also handle it, in terms of, let's say, I don't have to buy everything. Why do I have to buy everything? Today, you want to rent out a chair, right? You can use it like what's happening in the automobile industry, right? You can lease to own. For example, you go out to a BMW or a Mercedes showroom, and you say that, okay, I don't want to invest upfront. I'll pay you monthly and lease me out for 3 years, 4 years, whatever the period is. So this also is a possibility in medical equipment industry nowadays.
Now, adding to this, I was about to ask this question, like what has changed post-COVID and pre-COVID in terms of the procurement practices in general? Like what you thought was a bigger risk now, which is actually a part of a procurement process?
Seems like a big journey. We have done a quantum jump, I would say, in our procurement processes, policies, and the practices which we follow. Why? Because the risk which we had to cover, which nobody ever anticipated, that something like that, a pandemic which happened overnight, right? Within a month, the whole world's scenario changed, right? Supply chains were disrupted, manufacturing units got shut down, and shortages all across the world. And particularly in a country like UAE, where it is, I can say we are 98% for healthcare I'm talking about, we are 98% dependent on imports.
Right.
So nothing gets manufactured virtually here. Yes, there are a few partnerships which have been announced, by the way, also after COVID, like Neopharma and GlaxoSmithKline have recently joined hands to do local manufacturing. There's another facility which has come up to fill to finish vaccines, right? So these kind of things, forecasting, right, seasonality has also played a big role. Like we know from September to January is a flu season, for example. So these kind of forecasting was not happening earlier, right? That robust planning, and that forecast is given now. Earlier it was 4 months before, now it is 12 months before. So they know what is the demography of the population here, and plus UAE's stand overall as a healthcare provider is world class, because we know the country's demography is very, very vast and diversified. There are more than 198 nationalities living in this country, so they need their standard of care. And here it cannot. And I always quote this example that if I have 100 dirhams in my pocket, I can go to a 100 dirham worth of a restaurant. If I have 1,000 dirham in my pocket, I can go to a different category of restaurant. Depends on my spend capacity. But when it comes to the health, you cannot compromise. If a doctor prescribes that, okay, you have to go ahead with a 1,000 dirham worth of a test to be done, a diagnostic test, even if you cannot afford, you have to go, because it is about your life.
True.
Right? So it's non-compromisable. So on the back end, so that's the front end. When the doctor sees a patient, is the front end of the patient. But behind that, what happens where we don't, as the there's always a term called in our industry frontline heroes, right? We are the backline heroes who's relentlessly working to ensure that there is no redundancy in the supply chains. It cannot. I mean, we cannot. One of the most complex products, if somebody asks me, there was one conversation happening a couple of weeks ago in our canteen, and somebody asked me, Ajay, what was the most complex product you have ever purchased, which is never seen in a hospital? And I said, it is all the medical gases, right?
I have the question related to that. So what is we as a patient, we don't know what is the complexity behind, procuring item. But let's say, which is the most complex you see as a procurement professional? Which function is the most critical one and most complex?
I would say it is the medical gases, and what you see, right? What you feel if you go in an X-ray room, you see an X-ray machine. Yes, you are getting diagnosed for that. If you go into an OT, operating theater, yes, there is a surgery procedure. Something is going to happen. If it is a cardiology patient, somebody would be putting a balloon or a stent. If it is a minor wound or a cut, yes, there will be some stitches taken by a suture. If it is a simple normal cold and flu, you will be prescribed some pills to be taken. So you can touch and feel all these things, right? You can see it, but there is something called medical gases which is attached on the wall always, right? There's a tube running through from the MEP plant and coming right at the patient's bed. And if in emergency, obviously these gases, even in the operating theater, we need nitrous oxide, we need carbon dioxide, we need oxygen, we need mix of gases. And again, the concentration is different, right? When an infant, a newborn baby is in an incubator and an oxygen has to be provided, then the flow and the concentration of the oxygen is different. The purity is different compared to a geriatric patient, right? So these are the complexities which nobody sees. Because, and imagine, I mean, why I see this, because once we had an emergency, and I had to call the supplier to immediately deliver a few cylinders of oxygen in one of the hospitals, and the truck broke down on the way, and it caused a delay of 3 hours. And those 3 hours were the worst 3 hours of my life, because somebody's life is at stake. We cannot, and this is again what I just mentioned in the previous question which you asked me, that what were my learnings from COVID, that we have to have stock of each and every critical items. So, earlier we always do this A, B, C analysis, VED analysis, vital, essential, desirable products to be kept. All this is gone after COVID. It has turned around completely. And now we have critically started looking at, okay, what is life threatening, what is life saving, what is critical, what is essential, what is desirable, and then we have to see what is the route from where the product is coming, where is the warehouse of the supplier, right? So these are the route planning we do in supply chains. So these are the things we have always been a great learning after COVID.
One last question. So, is UAE doing anything unique in terms of procurement, like innovation, or is there a national policy alignment?
Every emirate is doing their own bit. Like Abu Dhabi's Department of Health has got a lot of initiatives which is run from the top. Dubai's Dubai Health Authority is also very aggressively, targeting and positioning itself to become one of the world's leading medical tourism hub. Right? If I would give you some numbers, in 2023 alone, which was right when the world was waking up and coming out of COVID, they did a revenue of 730 million dirhams, if I'm not mistaken, plus minus, in 1 year. So, which is a huge number compared to this country's size and this Emirates infrastructure. That's a really good, encouraging number. They are also focusing on a lot on advanced medical facilities to be provided for cosmetics, beauty. Industry is also ramping up really very well, and also as a federal government's vision, which is UAE's centennial vision of 2071. That's something they are really gearing up to ensure that yes, they give the best to the residents of this country and even the visitors of this country, whosoever wants to take a medical care, and thanks to the government, thanks to the leaders of this country, that they are really focused on what they want to give is non-compromisable to the patients coming
Sure.
for this treatments.
Well, thank you so much for joining us, and it's been a pleasure to have you with us.
Thank you for having me. Thank you for inviting me.
A lot of learnings, especially in the healthcare sector. And thank you so much for joining us, and we will be having more sessions. Stay tuned. Thank you so much.